Okay guys, let us start with the inhalational agents. Inhalational agents. Now, before starting the inhalational agents, I would like to ask you, what is the role of inhalational agent in general anesthesia? What is the basic purpose of using inhalational agent in general anesthesia? The role or the basic purpose of using inhalational agent in general anesthesia is what, guys? Inhalational agents are the ones or are the agents which are used to maintain the patient in unconscious state. So basically, inhalational agents are used as maintenance agents. They are used as what, guys? Maintenance agent. Yani they maintain the patient in an unconscious state. But some of the inhalational agents can be used for induction purpose too, such as we have already discussed Sevoflurane. Sevoflurane is used as an induction agent in children. Why? Because in children, if they don't allow you to put an IV cannula, how will you make the child unconscious? By giving inhalational induction, right? So anyways, guys, remember in the introduction of inhalational agents, what we need to write, what we need to make the point over there. Inhalational agent, what is the main function? Inhalational agent, what is the main function? The main function of the inhalational agent, they are used to maintain the patient in unconscious state. Maintain the patient in unconscious state. That is the main primary function. But in children, they can be used for induction purpose. In children, they can be used for induction purpose. In children, they can be used for induction purpose. And the agent that we use in children for induction purpose is Sevoflurane. The agent that we use in children for induction purpose is what, guys? Sevoflurane. Why Sevoflurane? Why? Because Sevoflurane is having sweet odor. It is having sweet odor, right? So now, this inhalational agents work on two principles. The inhalational agents works on two principles. One is the principle of MAC, other is the principle of blood gas partition coefficient. One principle is MAC, other is blood gas partition coefficient, right? So inhalational agent work on these two principles, MAC and blood gas coefficient. What is meant by MAC? MAC is nothing but minimal alveolar concentration. MAC is minimal alveolar concentration of an inhalational agent required to produce no response. What is MAC, guys? Minimal alveolar concentration of an inhalational agent required to produce no response in at least 50% of the subjects. Then it is called as MAC. In coming from the complex to simple language, MAC is what? Minimal dose of inhalational agent required to produce no response. That is MAC, right? Now, guys, in inhalational agent, I told you inhalational agents work on two principles. One is the principle of MAC, other is the principle of blood gas partition coefficient. First is what, guys? First is MAC. MAC is minimal alveolar concentration. What is the full form of MAC, guys? It is minimal alveolar concentration. What is the full form of MAC? Minimal alveolar concentration. But again, guys, you don't have to remember just the definition, just the full form of it. You have to remember what is the total definition of MAC. We'll write the definition of MAC from here, guys. MAC is the minimal alveolar concentration of an inhalational agent required to produce required to produce no response, required to produce no response to any surgical stimuli, to any surgical stimuli in at least 50% of the patient. In at least 50% of patient. Minimal alveolar concentration of an inhalational agent required to produce no response in at least 50% of the patient is called as MAC, right? MAC. MAC, what does MAC indicates, guys? MAC indicates the potency of the inhalational agent. What does MAC indicate? MAC is an indicator of potency. That is very important, guys. But this is the most important point, guys. MAC indicates the potency of the inhalational agent, but MAC and potency are always inversely proportional. MAC and potency are always inversely proportional. What is meant by inversely proportional, guys? Inversely proportional meaning what? Inversely proportional meaning what, guys? Look over here. If there is high MAC, yani if there is an agent that is having high MAC, it will be least potent. High MAC is equals to least potent. MAC is inversely proportional, right? Then if there is low MAC, inhalational agent having low MAC, it will be the most potent. High MAC is equals to least potent and low MAC is equals to the most potent, right? This is regarding what, guys? This is regarding the MAC, right? So MAC indicates the potency and this MAC value keeps on changing, right? Usually when the child is born, he'll be having a high MAC value. When he becomes an infant, the MAC value is highest in the infancy. But as we are aging, what happens to the MAC value? The MAC value decreases. The MAC value decreases, right? So remember, guys, this is regarding the MAC. But remember, MAC indicates what of the drug? MAC indicates the potency. To have a more better understanding, okay? To have a more better understanding, we'll go through it like this. Okay? Imagine we are having inhalational agent A. Inhalational agent A. And the inhalational agent A is present in very less quantity. Very less quantity. And imagine we are having inhalational agent B. And that inhalational agent B I am having in a very good quantity. Yani it is present in a good quantity. Okay? So there is patient A and patient B. In patient A, I use inhalational agent A in very less quantity. Yani that less quantity inhalational agent I'll give to the patient. Patient becomes unconscious. Whereas patient B, I have to give the inhalational agent in high quantity and more doses required, then the patient becomes unconscious. Now guys, you decide which inhalational agent is good. The one which I have given in a small quantity or the one which I have given in a large quantity. Anyone can tell the one that I have given in a less quantity, it is the most potent. Why? Why? Because less dose is required to produce no response. So remember, guys, remember, any agent that is having low MAC means low dose is required. Any agent that is having low MAC, it will be highly potent. Low MAC is equals to high potency, right? Low MAC is equals to high potency. And any inhalational agent that is having high MAC value, it will be least potent. It will be least potent. There are different inhalational agents having different MAC values, starting with nitrous. Okay, nitrous is having a MAC value of 105. Xenon has the MAC value of 70. Desflurane has the MAC value of 6. Sevoflurane 2. Halothane 0.75. Methoxy 0.16. These MAC values are in front of you, guys. You have to just tell me. You don't have to remember all the MAC values. Remember the extreme ones. The high MAC value is nitrous 105. The low MAC value is methoxy, which is 0.16. You guys tell me which is the most and which is the least potent. Which is the most, guys? Come on, what is the MAC value of nitrous? MAC value of nitrous is 105, यानी कि much concentration of nitrous is required, यानी कि high MAC is equals to least potent. So the least potent gas among all inhalational agents is what? It is nitrous oxide. Least potent is nitrous oxide. And which is the most potent among these inhalational agents? The most potent is methoxyflurane. The most potent is what, guys? Methoxyflurane. Why? Because it's having a low MAC. Low MAC, यानी low doses required. As nitrous is having a high MAC value, it is regarded as the least potent. And always remember, as it is least potent drug, it is not used as a sole gas. Always we use nitrous as a carrier gas. We use nitrous as a carrier gas. Come on, guys, what is this sole gas? What is this carrier gas? Sole gas means what? How can I explain? Okay, I'll explain it like this. You guys might have seen this movie called as Lagan. In Lagan, who was the sole actor or the lead actor? He was Amir Khan. Whereas the supporting actors in the Lagan, you guys might be telling Kachra and other things where the Kachra and other guys were the supporting actors. We don't know the names of supporting actors also. We just know the name of the lead actor, Amir Khan. Yes or no? Right? That is the difference between the sole and supporting. Over here also, nitrous cannot be used as a sole gas. It is a supporting gas or a carrier gas. You can use the hero if you want to take a hero out of inhalational agents. It could be halothane, it could be sevoflurane, it could be isoflurane. But if you want to choose a supporting actor, it is always nitrous. Why? Because least potent. Why least potent? Why? Because high MAC value. Nitrous is having a high MAC value. It is the least potent gas. It is used as a sole gas or a carrier gas. It's always used as a carrier gas. Okay? यानी कि with halothane, you always use nitrous as a second gas. With sevoflurane, we use nitrous as a second gas. Okay? So that's regarding the MAC. So I told you guys, inhalational agents work on two principles. One principle just now we have discussed, that is MAC. What is the other principle that the inhalational agent work on? The other principle that the inhalational agent work on is blood gas partition coefficient. Blood gas partition coefficient. What is meant by blood gas partition coefficient? Blood gas partition coefficient meaning what, guys? What is blood gas partition coefficient? Blood gas partition coefficient, it is nothing but the solubility of inhalational agent in the blood. What does it determine? Blood gas coefficient is a referee or it is an indicator of the speed of onset and recovery. Blood gas partition coefficient indicates the speed of onset and recovery. But same like MAC, blood gas partition coefficient is also inversely proportional to the speed of onset. Right? What is inversely proportional meaning? Once again, any agent that is having high blood gas partition coefficient will have slow onset and slow recovery. And any agent that is having low blood gas coefficient will be having fast onset and fast recovery. Fast onset and fast recovery. Any agent that is having high blood gas will be slow onset and slow recovery, whereas low blood gas will be fast onset and fast recovery, right? So blood gas coefficient we are discussing. Blood gas partition coefficient we are discussing. So blood gas partition coefficient is an indicator of solubility of inhalational agent into the blood. Now guys, look over here. Whenever you are giving any inhalational agent to the patient, the main function is it maintains the patient unconscious. Right? Whenever you give any inhalational agent to the patient, you are keeping the mask on the patient's mouth. The patient is inhaling the fumes, right? Those inhaled fumes go towards the lungs. From the lungs, they get absorbed into the blood. From the blood, it has to reach the destination, that is brain. The final destination is brain, right? So whenever you give inhalational agent, first they go to the lungs. From the lungs, they go to the blood. from the blood they have to reach the brain. But there are some inhalational agents which are having high blood gas solubility. What does high blood gas solubility means? Whenever I give those inhalational agents which are having high blood gas solubility, what will happen? Those inhalational agents, when given to the patient, it will go from the lungs into the blood. It will go from the lungs into the blood. From there it has to go to the brain. But high blood gas meaning what? They will be highly soluble in the blood. From the lungs, they go to the blood, they settle down in the blood. They are settling down. Lazy inhalational agent, they are soluble in the blood. If they are soluble in the blood, less amount of it will go to the brain. If less amount of inhalational agent is going to the brain, how will be the speed of onset? The speed of onset will be slow. It will be slow onset and there will be slow recovery. Slow onset and slow recovery. So remember guys, for this reason I told you what? High blood gas means more soluble in blood, less going to the brain. It will be slow onset. And any inhalational agent that is having low blood gas. What does low blood gas means? We give this inhalational agent, from the patient inhales it, from there it goes to the lungs, from the lungs it goes to the blood, right? But from the blood it directly jumps to the brain. Yani it is not staying in the blood. Low blood gas means less soluble in the blood. It is directly going to the brain. Means how will be the onset? It will be fast onset and fast recovery. So remember guys, inhalational agents having high blood gas coefficient will be slow onset, slow recovery. Inhalational agents which are having low blood gas coefficient will be fast onset and fast recovery. Right? So remember, blood gas coefficient indicates the speed of onset and recovery. Right? Speed of onset and recovery. Right? Agents with high blood gas coefficient, it will be slow onset. Agents with low blood gas coefficient, it will be fast onset. There are some blood gas coefficients given guys. There are some values of blood gas coefficients given. We have to remember that. There are some examples such as Desflurane. The fastest onset is Desflurane. The second fastest is Sevoflurane. Desflurane is having a blood gas coefficient of 0.42. Then there is Methoxyflurane, which is having a blood gas coefficient of 15. You guys decide now which is the fast and which is the slow onset. Two values are in front of you. I told you high blood gas, slow onset. Low blood gas, fast onset. The blood gas coefficient of Desflurane is 0.42, whereas methoxy is 15. So which is the fast onset guys among these two? One which is having low blood gas. Which is having the low blood gas coefficient? Desflurane. So hence Desflurane is the fastest acting inhalational agent. Fastest acting inhalational agent. So guys, which is the slowest? The slowest is methoxyflurane. Why methoxyflurane is the slowest? Why? Because it is having high blood gas coefficient. It is having high blood gas coefficient. So any agent that has a low blood gas coefficient, it will be fast onset, and slow blood high blood gas coefficient, it will be slow in onset. Slow in onset, right? We have discussed about these two agents. Now again guys, I am giving you the option Desflurane and methoxyflurane, and I tell you to use one inhalational agent in daycare surgery. Which one will you use? Will you use Desflurane or will you use methoxyflurane for daycare surgery? Come on guys, which one will you use for daycare surgery? For daycare surgery, you want an agent that has a rapid onset and rapid recovery. So remember, what will be the answer? For daycare surgery, sir, I will use Desflurane. Why, sir? Why will you use Desflurane? Why? Because it is having speed onset and speed recovery, right? So remember guys, if the MCQ is asking you in daycare surgery, which is the how you will give general anesthesia to the patient. Remember guys, if the MCQ is asking you how do you give general anesthesia for daycare surgery patient, your answer should be what? First, I will give an IV induction agent. What is the IV induction agent of choice for daycare surgery? Propofol. Then I will relax his muscles by giving mivacurium. Mivacurium, the shortest acting non-depolarizing mivacurium for daycare surgery. Then, which is the inhalational agent used for daycare surgery, guys? First, I make the patient unconscious by propofol. I relax his muscle by mivacurium. And the inhalational agent of choice for daycare surgery is Desflurane. What is the inhalational agent of choice for daycare surgery? Desflurane. Desflurane. Right? If Desflurane is not there in the option, the second fastest acting you can choose Sevoflurane. Nowadays, Desflurane is a bit costly. So the second best we are using commonly, which is Sevoflurane. Sevoflurane. That is regarding the daycare surgery. All three columns, IV induction, muscle relaxant and inhalational agent of choice for daycare, we have discussed. Okay. So anyways, guys, we are talking about what? We are talking about the inhalational agents, right? We are talking about the two principles, the MAC and blood gas partition coefficient. MAC and blood gas partition coefficient. Right? Now, what else we need to talk? Coming to the best part of the inhalational agent. What is the best part? The effects of inhalational agent on various systems. Various system means what systems we need to cover, guys? We need to cover the CNS. We need to cover the respiratory. We need to cover the CVS. We need to cover the muscle, and last system is analgesia. Systems top to bottom. First CNS, right? Remember, two systems right on this side, two systems right on this side. Okay? First, what we need to remember, guys, the summary of the inhalational agent's effect on various systems. The summary of the effects of inhalational agent on various systems, I used to remember, I'll teach you in that manner only. For CNS and CVS problem, the best inhalational agent used. For CNS and CVS problem, the best inhalational agent used is Isoflurane. Best, the most common basically. For CNS and CVS problem, most commonly used inhalational agent is Isoflurane. CNS and CVS, Isoflurane. Whereas for the respiratory and muscle, the most common inhalational agent that is used is halothane. Respiratory and muscle, the most common inhalational agent that we use is halothane. In analgesia, we need to remember two inhalational agents can be used as good analgesic. One is nitrous, other is trilene. The best analgesic inhalational agent is trilene. The best is what, guys? Trilene. Okay. So the summary of inhalational agent we need to remember, for CNS and CVS most commonly uses ISO, whereas for the cardiovascular and muscle the most commonly uses halothane. What are we left out with? Analgesia. In analgesia, you need to remember what? The inhalational agents having analgesic property are nitrous and trilene. Nitrous and trilene. So that's regarding what? That's regarding the summary of inhalational agents. That's regarding the summary of inhalational agents. That doesn't mean that we don't have to discuss all. We have to discuss the points. Okay? What points we need to discuss over here? First system. What is the first system that we need to cover in the inhalational agent? It is the CNS. So I told you, if you remember the summary, guys, the most common inhalational agent used in CNS as well as CVS problem is what? Isoflurane. Why iso? Why not other agents? Why? Because almost all inhalational agents increases the intracranial pressure. And you guys know, once the inhalational agent increases the intracranial pressure, it will be contraindicated in head injury and neurosurgery, right? So almost all increases the intracranial pressure except Isoflurane. Isoflurane decreases the intracranial pressure, Hence, it is the IV induction agent of choice. Hence, it is the IV induction agent of choice for head injury and neurosurgery. Head injury and neurosurgery. Isoflurane is the IV induction agent of choice for head injury and neurosurgery. Right? One more point regarding CNS, what we need to remember is, one more extra point, what we need to remember regarding the CNS is, there is one agent called as Enflurane, which is highly contraindicated for any CNS problem. Enflurane is highly contraindicated. Why, sir? Why Enflurane is highly contraindicated? Why? Because Enflurane not only increases ICP, Enflurane is also causing epilepsy. Enflurane is the most epileptogenic. It is the most epileptogenic inhalational agent. Epileptogenic inhalational agent. Remember guys, Enflurane starts with E, epilepsy starts with E. Enflurane starts with E and epilepsy also starts with E. So Enflurane is the most epileptogenic inhalational agent that is basically avoided for any CNS problems. So that's regarding what guys? That's regarding the effects of inhalational agent on central nervous system, on CNS. Okay. Next, what's the system? Even though in your notes it is respiratory, but should we discuss the respiratory? No sir. We are going with the summary. So CNS and CVS, one agent is commonly used, that is Isoflurane. Whereas for the respiratory and muscles, one is commonly used, that is halothane. Right? So next is the CVS guys. Next is the cardiovascular system. We'll write the cardiovascular system over here on this slide. What will the inhalational agents do to the cardiovascular? If you go with the summary, which is a commonly used inhalational agent? ISO. But why are other inhalational agents avoided? Why? Because almost all inhalational agents, we have to write in the cardiovascular guys, almost all inhalational agents decreases the cardiac output, almost all inhalational agent, it decreases the cardiac output, leading to what guys? Leading to hypotension. But there is one inhalational agent called as halothane. Halothane, not only it causes hypotension, it also causes bradycardia. Halothane is highly contraindicated in heart disease. Halothane is contraindicated in heart disease. One reason why it is contraindicated is it causes hypo and brady, plus halothane increases the sensitivity of myocardium towards catecholamine. I guess most of you haven't got this point. Okay? All in all, remember, halothane is contraindicated in heart disease. Why? Because it causes hypo and brady. But the second point, the bouncer point that went like a bouncer to you is what? Halothane increases the sensitivity of myocardium towards catecholamine. To understand this, again we'll go through a case. The case over here is what guys? The patient is posted for ENT surgery such as nasal polyp surgery. The patient is posted for what? Nasal polyp surgery. If a person is posted for nasal polyp surgery, which anesthesia will you give? Answer should be, sir, it depends on how much is the nasal polyp size. If it is a small polyp, it can be done under local. If it is a large polyp, then you have to go for what? General anesthesia. Imagine the patient is posted for large nasal polyp removal under what anesthesia? Under general anesthesia. Now guys, what we need to know if the patient is having large nasal polyp under general anesthesia? Imagine you are in the maintenance phase of general anesthesia. Okay? In the maintenance phase, how will you maintain? First of all, guys, before going to the maintenance phase, what were the 4 phases of anesthesia? Pre-oxygenation, induction, maintenance, reversal. You pre-oxygenate the patient for how many minutes? 3 to 5 minutes with 100% of oxygen. Second is induction. What is your aim in the induction phase? First aim is I will make the patient unconscious. Second, I will make the muscles relax. Third, I will intubate. Induction is done. Next is maintenance. Imagine in this patient you are maintaining. Remember in the maintenance, what are the 3 aims? Maintain the patient unconscious, maintain muscle relaxation, and maintain the ventilation. Imagine you are in the maintenance phase and you are maintaining the patient unconscious by using halothane. Now guys, now the surgeon usually starts the surgery in the maintenance phase of general anesthesia. As he is starting the surgery in the nose, he will take an injection of adrenaline and he gives that injection of adrenaline into the nasal mucosa. Why does he give injection of adrenaline before surgery? Why? Because if you give adrenaline into the nasal mucosa, what will it cause? Adrenaline causes vasoconstriction that will decrease the blood loss. Nose is having an abundant blood supply, yes or no, right? So we give the injection of adrenaline into the nasal mucosa so that the patient should not have blood. But while giving the adrenaline, he will tell the anesthetist, sir, I am using adrenaline. If you are using halothane, please stop it. Why is he requesting? Why? Because if you use halothane and give adrenaline, what will happen? Coming to our bouncer point. What was the bouncer point? Halothane increases the sensitivity of myocardium towards adrenaline, towards catecholamine. What is the catecholamine given over here? Adrenaline. If you use halothane with adrenaline, what will happen? Halothane will take that adrenaline towards myocardium, leading to what? Leading to arrhythmias. So all in all, halothane should be contraindicated. Halothane should be avoided in heart diseases. All inhalational agents are also avoided. Which is the best inhalational agent for heart disease? Best inhalational agent for heart disease. It is not ISO, guys. It is Desflurane. Now you must be confused, sir. In the summary you have written Isoflurane. Isoflurane is not the best. Isoflurane is the most commonly used inhalational agent for heart disease. Most commonly used inhalational agent for what disease? Heart disease is what, guys? Isoflurane. Now you must be having confusion. What is the difference between the best and the most common? Guys, if I give you an option and I tell you that you have to go to Kerala, right? If I'm telling you, I'm giving you an option, you have to travel to Kerala. For traveling to Kerala, the best way to come out to Kerala or go to Kerala is by what? Flight. But most commonly what we choose, we are a budget friendly people. What are we choosing? Most commonly we choose the train. The reason being what? Even though you know the best is what? Flight. But most commonly what we choose? Train. The reason is what, guys? Budget. Budget means what? Flight is having a double budget of the train, double to triple budget of the train. Yes or no? Right? Remember, guys, same as the story with Desflurane. Even though Desflurane is the best one, but most commonly we choose what? Isoflurane. Why? Because Desflurane requires to be stored in a special vaporizer, which is very costly. Desflurane requires to be stored in a vaporizer. Remember, guys, all inhalational agents are stored in a device called as vaporizer. But our Desflurane requires a special vaporizer as it is having a low boiling point, and that vaporizer is very costly. Hence, the best agent is Desflurane, but most commonly we choose what? Isoflurane. Even though we know that with Isoflurane, patient will have, not all, some of the patient will have this side effect called as coronary steal phenomena. Coronary steal phenomena. With isoflurane, you can see a side effect called as coronary steal phenomena. Now again guys, you must be wondering, what is this coronary steal phenomena? Once again, I will give you a case and so that you can understand what is coronary steal phenomena. Now guys, imagine there is a patient or there is a guy who's eating burgers, who is eating pizzas. He's eating burger, he's eating pizzas, and due to that eating of burgers and pizzas, he's getting some cholesterol deposits or he's getting some lipid deposits in the arteries. Imagine his right coronary artery being partially blocked, and imagine his left coronary artery is totally normal. Right, you can see over here, it is partially blocked, and left is totally normal. Okay, if this patient receives isoflurane, what will happen? Isoflurane goes to the right as well as left coronary. But what will isoflurane do? Isoflurane has the habit of stealing. Isoflurane steals the blood from already blocked coronary and gives the blood to what? A good coronary. Gives the blood to the good coronary. So basically, isoflurane is stealing the blood from the bad coronary and giving the blood to the good coronary. You know guys, you know what? Who was Robin Hood? Robin Hood was the guy who used to steal the money from the rich and give it to the poor. Right? Isoflurane is a reverse Robin Hood of the cardiovascular. What does this reverse Robin Hood means? When you give isoflurane to the patient, it will steal the blood from the poor coronary and give the blood to already rich coronary. Okay? So that is called as coronary steal phenomena. That's called as what guys? Coronary steal phenomena. Coronary steal phenomena, right? So the most commonly used inhalational agent for coronary steal phenomena is what guys? Sorry, most commonly used inhalational agent for heart diseases, isoflurane. Even though the best is what? Des. But most commonly we choose iso. That's regarding the cardiovascular system. That's regarding what system? Cardiovascular we have already discussed. Cardiovascular we have already discussed. The most commonly used is isoflurane. Even though the best is desflurane. Now next is what? We have discussed the cardiovascular system. We have discussed the CNS. CNS, CVS के बाद में क्या पढ़ेंगे? Respiratory and muscles. For that, again recollect the summary. For respiratory as well as muscle, the best inhalational agent that is used is halothane. First, we will discuss about other inhalational agents. Just remember, guys, almost all inhalational agent causes bronchodilation. Causes what, guys? Bronchodilation. But maximum bronchodilation is seen with halothane. Maximum bronchodilation is seen with what, guys? Halothane. For this reason, halothane is regarded as inhalational agent of choice in asthma. Inhalational agent of choice in bronchial asthma. Halothane is regarded as the inhalational agent of choice in bronchial asthma. That is regarding the respiratory system. Right? Next, respiratory and muscles we need to study together. Why? Because on muscle, almost all inhalational agent causes some degree of muscle relaxation. Some degree of muscle relaxation. Maximum muscle relaxation is seen with halothane. Maximum muscle relaxation is seen with halothane. Right? Halothane is coming as a very important inhalational agent. I will teach you how to remember those points later. Okay? Next is analgesic property. Only two inhalational agents are having good analgesic property. What are those two? Nitrous and trilene. In that also the best inhalational agent for analgesic system, or the inhalational agent having or producing maximum analgesia is trilene. Is what, guys? Trilene. So that's regarding the effects of inhalational agent on various system. Once again, guys, the summary is very, very important. For CNS and CVS, we use what? We use isoflurane. For respiratory and muscle, halothane. Whereas for the analgesia, nitrous and trilene are having good analgesic property. In that, the best analgesia is seen with trilene. Best is seen with what, guys? Trilene. Right? So this was regarding what? This was regarding the inhalational agents' effects on various systems. Now we need to discuss the metabolism of it. Where are the inhalational agents metabolized? Guys, look over here. As we give the inhalational agent to the patient, the inhalational agent is taken from the lungs, it goes into the blood, and 99% of its metabolism, guys. Remember, guys, 99% of its metabolism is occurring in the lungs only. Okay, just cut it down. We'll repeat it once again. Metabolism of inhalational agent. Okay? Metabolism of inhalational agent. Guys, whenever we are giving this inhalational agent, it goes into the lungs. We inhale them and it goes into the lungs. 99% of its metabolism is occurring in the lungs. For 1% of its metabolism, it occurs. For 1%, it depends on the liver. 1% metabolism, it depends on the liver. So 99% of metabolism of inhalational agent, where it is occurring, guys? In the lungs. 1% it depends on the liver. But there is one inhalational agent that is having a good amount of metabolism in the liver. What is that inhalational agent again? Our hero, halothane. Halothane is having 20% of metabolism in the liver. Right? Halothane undergoes maximum metabolism in the liver. So guys, if a person is there who is repeatedly posted for some surgeries, yani ke January that patient was posted for some surgery under general anesthesia. In March again the same patient is posted for surgery under general anesthesia. Can you repeatedly give halothane to the same patient? You can't give. Why you can't give? If you give halothane repeatedly to the patient, what will happen, guys? Halothane will damage the liver cells leading to hepatitis. That is called as halothane-induced hepatitis. That is called as what, guys? Halothane-induced hepatitis. So remember, halothane is the most metabolized inhalational agent in the liver. That's regarding halothane. Next is Desflurane. Desflurane is the least metabolized in the liver. 99.9% of its metabolism, 99.9% of its metabolism is occurring in the lungs. Less than 0.1% of metabolism, or less than 0.1, less than 0.01, less than 0.01%, it is depending on the liver. As Desflurane is least metabolized in the liver, has least problem with the liver, I can say that Desflurane is the inhalational agent of choice for hepatic failure. Desflurane is the inhalational agent of choice for hepatic and renal failure. Why? Because the inhalational agents, 99% of metabolism as well as excretion is occurring in the lungs only. Desflurane also metabolism and excretion, but 99.9% it is occurring in the lungs only. Okay, it does not depend anything on the liver, right? So remember, guys, the least metabolized inhalational agent is Desflurane. Desflurane. So guys, remember, I told you, if a patient is having hepatic failure, what is the inhalational agent that we will give? Will you use halothane or Desflurane? We will give what? We will give Desflurane. We will give Desflurane. Why? Because it is least metabolized in the liver. It has nothing to do with the liver, right? So that's regarding what? That's regarding the inhalational agents metabolism. Okay? The most metabolized in the liver is what? Halothane, right? 20%. Hence, whenever you use halothane, repeatedly in the same patient, patient might land up into halothane-induced hepatitis. Halothane-induced hepatitis, right? And the least metabolized inhalational agent in the liver is what? Desflurane, which is having less than 0.01% in metabolism in the liver, right? So it can be used for daycare surgery. It can be used for hepatic failure. The last thing is methoxyflurane. Regarding methoxyflurane, what we need to remember, methoxyflurane, after being metabolized, it produces fluorides. Methoxyflurane, after being metabolized, it produces fluorides, and that fluorides can cause renal failure. Methoxyflurane on metabolism produces fluorides. This methoxyflurane on metabolism, it produces fluorides, and that fluoride production can cause what failure? That fluoride production can cause renal failure, right? Methoxyflurane on metabolism produces fluoride, hence it is the most nephrotoxic inhalational agent. Why? Because it can cause renal failure. So in metabolism, only 3 points, guys. The most metabolized in the liver is halothane. The least metabolized in the liver is desflurane. Whereas methoxyflurane, after being metabolized, it leads to formation of compound called as fluorides that can cause high output renal failure. It is the most nephrotoxic inhalational agent. Okay. Now guys, coming to the summary of inhalational agent. If someone is asking you about the summary of inhalational agent, we'll start with halothane, guys. Again, recollect the points of halothane in your mind. First recollect, take some time to recollect the points of halothane. What is coming to my mind is halothane. When anyone is asking me about halothane, two systems are coming to my mind. Halothane is most commonly used for respiratory and muscle. Why? Because it causes maximum bronchodilation and maximum muscle relaxation. Good. Next, what comes to my mind regarding halothane? Halothane is avoided in heart disease. Why? Because it causes hypo and brady, plus it increases the sensitivity of myocardium towards catecholamine. Apart from that, what else we need to recollect about halothane? Any more points of halothane? Okay, halothane is having maximum metabolism in the liver, hence it can cause halothane-induced hepatitis. Last point of halothane that comes to my mind is halothane is causing hyperthermia, malignant hyperthermia. I told you almost all inhalational agents causes malignant hyperthermia, but maximum incidence of malignant hyperthermia is seen with halothane. Now guys, look over here. In the inhalational agents, the two things which are very, very important. In the inhalational agents, the two things which are very, very important is the summary of inhalational agent and second, halothane. If halothane is being asked, what you need to remember? Halothane, if someone is asking you about halothane, the immediate answer should be what? 4 H's of halothane. How many H's, guys? 4 H's of halothane. The first H of halothane is what? What is the first H of halothane? We are discussing about the 4 H's of halothane. The first H of halothane is what? Right. First H, second H, third H, fourth H. First H is what? Halothane is contraindicated in heart disease. Halothane is contraindicated in heart disease. That's the first H. Second H of halothane is what? Halothane produces hyperthermia. What hyperthermia, sir? Halothane produces malignant hyperthermia. Third H is what? Hepatitis. Halothane causes halothane-induced hepatitis. The last H of halothane is what, guys? Halothane has 3 maximums. What 3 maximum? Maximum metabolism in liver. Right? Next, it has maximum bronchodilation. And third is what? It has maximum muscle relaxation. So this is the summary of halothane, 4 H's of halothane, guys. If anyone is asking you, remember, you can tell halothane is having a MAC value of 0.75 and it is stored in amber or red color bottles. Okay, but you have to remember this 4 H's of halothane. The first H, contraindicated in heart disease. Second H, hyperthermia. What hyperthermia we are talking about? Malignant hyperthermia. The third H of halothane is what? Halothane causes hepatitis on repeated use in the same patient. Last, halothane has 3 maximums. What maximums are we talking about? Maximum muscle relaxation, maximum bronchodilation, and maximum metabolism in the liver. Maximum metabolism in the liver. That's regarding the summary of what? Halothane. Coming to the summary of isoflurane. Come on, guys. Don't look into your notes. Don't look at me also. When anyone is asking you about isoflurane, recollect the things in your mind. You will get the answer. Recollect the things according to the summary of the effect. So what comes to your mind? Isoflurane is the most common inhalational agent used for CNS and CVS problem. CNS and CVS problem. The most commonly used inhalational agent is isoflurane, right? Apart from that, basically isoflurane is the most commonly used inhalational agent for head injury neurosurgery as well as for heart surgery. Which is the best agent for heart surgery, guys? Best inhalational agent? Desflurane. But why commonly we choose iso? Why? Because isoflurane, why? Because desflurane requires a special vaporizer which is very costly. Even though we know isoflurane causes a small side effect on heart. What side effect? Isoflurane causes a phenomena. What phenomena? Coronary steal phenomena. Coronary steal phenomena. So we have already discussed it is a inhalational agent used in neurosurgery. Inhalational agent used for cardiac surgery. Most common is it's always iso, right? Best is desflurane, but commonly we use iso. Even though it causes a phenomena. What is that? Coronary steal phenomena. Coronary steal phenomena. So that's regarding what? That's regarding isoflurane. Next, sevoflurane. Next inhalational agent is sevoflurane. Now guys, remember sevoflurane. What we need to remember regarding sevoflurane, what comes to my mind? Sweet. Sweet is liked by children. So sevoflurane is the inhalational induction agent that can be used in children. Why? Why? Because sevoflurane is having what odor? It is having a sweet odor. Desflurane, isoflurane, they have pungent odor. Desflurane also causes irritation of the airway. So anyways, we are talking about sevoflurane. Sevoflurane, is it the fastest acting? No. This is the second fastest acting. Fastest acting inhalational agent. Who determines who is fast and all? Blood gas coefficient is the referee to determine who is fast. So any agent that is having low blood gas will be the fastest. Low blood gas is 0.42 seen with Des. That is the fastest, Desflurane. Second fastest is 0.69, that is Sevoflurane. Sevoflurane is the second fastest acting inhalational agent and it can be used for induction purpose in children. Why? Because children are not allowing you to put an IV cannula. One extra point of sevoflurane that we need to remember is sevoflurane is avoided when you are using a closed breathing circuit. When you are using a closed, we will discuss the circuits later, but remember, whenever you use a closed breathing circuit, never give sevoflurane. Why? Because it reacts with the soda lime. Remember, in closed circuit, all the carbon dioxide is absorbed by soda lime. In closed circuit, if you give sevoflurane, that sevoflurane reacts with the soda lime to form a toxic compound called as compound A or olefin. Compound A or olefin. So sevoflurane is avoided in low flow anesthesia or closed circuit, right? Next is desflurane, the agent which is having pungent odor. Pungent odor which causes airway irritation. Which causes airway irritation. It is always desflurane. What comes to your mind regarding desflurane? It is the best agent for what diseases? Basically, it is the best agent for heart disease, best for daycare. I used to remember DES is the best. DES is the best. Why? Best agent for cardiac disease, best agent for liver pathologies. Why? Because it is having least metabolism in the liver. Apart from that, it is the best agent for daycare surgeries. Right? So those points we have to remember. But even though best, it is not used commonly. Commonly, we are using other agents, which is a commonly used agent for cardiac disease. Even though the best is DES, commonly we choose what? Isoflurane. Isoflurane, right? Next, which is the best for daycare surgery? Best is Desflurane. The second best or most commonly used is Sevoflurane. Sevoflurane. Why? Because again, Desflurane is costly. We go for Sevoflurane most commonly. But best is what, guys? Best for daycare is Desflurane. So Desflurane is least metabolized inhalational agent, but as it is stored in a vaporizer, which is very costly, it is not commonly used, right? It can be used best agent for daycare surgery, but most commonly used inhalational agent for daycare surgery is what? For daycare surgery is what, guys? Sevoflurane. Sevoflurane. And apart from that, it is the least cardiac depressant and used for liver surgeries. We have discussed all the points, guys. We are just revising it. Okay. So nitrous, what we remember about nitrous, guys? Nitrous is the least potent inhalational agent. And from the summary, we have to recollect nitrous is having a good analgesic property. Nitrous is stored in what color cylinder? Blue color cylinder. Remember, guys, nitrous is a non-volatile gas. All non-volatile gases are stored in cylinders, whereas all volatile gases are stored in a device called as vaporizer. So nitrous is stored in a blue color cylinder. All these cylinders are given color coding so that you can identify what gas is present in the cylinders. Okay. For the nitrous, what we need to remember, nitrous you avoid in pregnant ladies. You never give nitrous in pregnant ladies. Why? If you give nitrous in pregnancy, what will happen? That nitrous, especially it is avoided in the first trimester, that nitrous will cross the placenta, leads to teratogenic effects on the baby. Hence, nitrous is avoided in pregnant ladies, especially in the first trimester. Why? Because it crosses the placenta and causes bone marrow depression. Bone marrow depression. Apart from that, nitrous should also be avoided in closed loop surgeries. In closed loop surgeries, such as if a patient is having intestinal obstruction due to volvulus or interception, if the patient is having obstruction, never give nitrous. If you are giving general anesthesia, don't give nitrous. Why? Why? Because that nitrous will go towards the obstructed part. Remember, if intestine is obstructed, the proximal part proximal to the obstruction will be dilated, yes or no? So what will happen? Nitrous will go towards the dilated part and it will further dilate it, or it will further inflate that part, that can cause rupture of the intestine also. So nitrous has this ability to expand the air containing cavities. Hence, it is avoided in closed loop surgeries. Nitrous is avoided in closed loop surgeries. Closed loop surgeries. That's regarding what, guys? That's regarding the nitrous oxide. That's regarding the nitrous oxide. Right? So this was regarding the inhalational agents. Okay, guys? Thank you.